First of all, I'd like to explain what exactly an enema is. An enema is a procedure in which liquid or gas is injected into the rectum to expel its contents or to introduce drugs or permit X-ray imaging. There are several different classifications and types of enemas depending on their purposes and other different types of classifications. So first of all, I'd like to talk about a specific classification in which enema is divided into two types: evacuant enema and retained enema. So, to how to differentiate between the two is evacuant enema are given to produce an immediate effect. They are usually used to lubricate, thus facilitating the passage of feces. The administration of fluid into the rectum may also induce peristaltic contraction of the rectal walls. So that's mainly evacuant enemas. When in the case of retention enemas, they produce the same effect as an evacuant enema, but they are mainly intended to remain in the rectum for a longer period of time, penetrating and thus lubricating the feces further. Retention enemas tend to be oil-based. So here I've also given different classification of different types of evacuant enemas and different types of retained enemas. But the use of each of these type of enemas and their purposes I will be discussing further on. Moving on, another classification would be according to purpose. So according to purpose, enemas are divided into four types: cleansing, carminative, retention, and return flow enema. So mainly today I want to focus on cleansing enema and its types. So in the case of a cleansing enema, it is probably the most common type of enema. Its purpose is intended to remove feces. So its mechanism of action is this type of enema stimulates peristalsis via irritation of the colon or rectum and by causing intestinal distension with the fluid. So some indications are they are used to remove feces in instances of constipation, prepare the intestine for certain diagnostic tests such as X-ray or visualization tests such as the colonoscopy, and also to prepare the patient for surgery, that is to prevent the escape of feces during surgery. So there are certain types of cleansing enemas such as tap water and normal saline enemas, soap solution enema, hypertonic saline enema, and these enemas are usually kept for 15 to 20 minutes and then expelled. So that was cleansing enemas. Now, to talk about the different types of enemas and their indications, I've listed them here, and it would be easier to understand what the different type of enemas are and what their purposes and indications are. So to start off, to stimulate defecation and to treat constipation, you have simple evacuant enemas. To soften hard fecal matter, you use oil enemas. To administer medication, you use sedative enemas. To protect and soothe the mucous membrane of intestine and to check diarrhea, you use emollient enemas. To destroy intestinal parasites, you use antihelminthic enemas. To relieve the gaseous distension, you use carminative enemas. To administer fluid and nutrients, you use nutritive enema. To relieve inflammation, you use astringent enemas. To induce peristalsis, you use purgative enema. To stimulate a person in shock and collapse, you use stimulant enema. To reduce the temperature, you use cold enema or ice enema. Moving on, certain contraindication and risk of administering enemas. So patients, usually enemas are contraindicated in patients following colonic surgery or patients with injury or obstruction, gynecological surgery or radiotherapy, cases of paralytic ileus as the peristaltic movement of the colon is lost, ulcerative and inflammatory conditions, patients with fecal stones, rectal obstruction by tumor or rectal prolapse, active coronary heart disease, in comatose or non-compliant patients, cancer patients under chemotherapy, and in other immunocompromised patients, especially those with severe neutropenia. So that would be all for my presentation on enemas. I hope that it was informative and useful. Thank you very much.